Like hyalase is a substance that is used to dissolve hyaluronic acid.
What are the other complications that we can get if we get a hyalase injection? Hi, Dr. Syed.
Hello.
Hi. So I just wanted to know about recently there was a news about Urfi Javed got swelling on her face,
Yes.
and everyone was waiting to know what happened, what went wrong. Can I know more about that, sir?
See, basically, thank you for having me at your podcast, guys. This is very common. This was not anything serious issue because of any fillers. It was just a reaction to a substance called hyalase. The hyalase is used to dissolve any undesired effects or anything which we don't like post injections of with hyaluronic acid. So that is to dissolve, and sometimes it can react and give swelling.
Okay.
Yes.
So it was actually hyalase which is used to dissolve. Many people were thinking it was because of the filler itself.
No, not at all. It was just because of the hyalase, and that hyalase sometimes reacts and it gives a hypersensitivity reaction where that can give swelling around that area, especially the lips. If we need to dissolve extra filler around the lips, and lips being very sensitive, it gives too much of reaction, and that hypersensitivity reaction gives you swelling and edema.
So that edema will go off in few days, or how is it like approximately a person can expect when can the swelling and
See, yes, it goes. It takes around 24 hours, and gradually it will settle down. However, we recommend to use certain medications like anti-allergics, sometimes corticosteroids. We might have to give to patients to quickly resolve those symptoms.
Okay.
Yes.
So, what are the other complications that we can get if we get a hyalase injection?
See, I must tell you guys that before we do, like hyalase is a substance that is used to dissolve hyaluronic acid, and it has got a lot of medical indications apart from just the cosmetic indication. In medical indications, it is meant for the pain management. It is also used in facilitating the absorption of certain fluids like normal saline or certain anesthetic products or immunoglobulins into the skin. So it facilitates and increases the absorption. It has got immune modulatory effects and many other medical indications it has got. When coming to the cosmetic use, it is used only to hyalase or to dissolve the extra product which has been injected. Many a times we do get complications because of the fillers. For God's sake, a complication called necrosis or vascular compromises, or some other compromise or other some kind of complications. For sometimes a lump or an infection, or sometimes that exaggerated results the patient may not like. So at that moment, we recommend and we hyalase that area. I mean, we just get rid of that extra product in that area, and that's how it is being used in cosmetic dermatology.
Okay. So hyalase injection, is it painful or it is less painful compared to other injectables?
So ideally, the protocol is like that. If it's meant for the cosmetic indications, it is good to do a test dose. However, test dose is sometimes still, even if it is the patient is reacting, but the hypersensitivity nature of that patient, and occasionally before we do hyalase that patient, we put him on some anti-allergic medications, or we put him on some corticosteroids so that he will not overreact to that hyalase. So yes, that's how it's being done. And coming to the pain, yes, sometimes it gives a little bit of pain, but it's quite safe if done by experts.
Okay. So the take-home message is that it should always be done by experts, of course.
Absolutely. The take-home message is that if somebody has got the filler done, it's better to consult your doctor who has done it, and doctor should give you a test dose and put you on anti-allergics if required, and then guide you and counsel you that this reaction can happen. There can be swelling, edema around that area, and nothing needs to be worried or you need to worry of, and you need to consult your skin specialist or a plastic surgeon or that physician who has done that injectable at that time.